Hello, Namaskar. I am Dr. Ved Prakash from India. I am feeling very humble. In fact, I am feeling proud and very humble to be invited in this conference at London. I was doing modern medicine practice till the year 1998. At that time, luckily, I was introduced to the acupuncture and did my formal training in acupuncture as per WHO standards and was doing all type of cases including eye patients till the year 2001 when I switched over exclusively to the eye patients suffering from retinal degeneration, retinitis pigmentosa, macular degeneration and optic nerve atrophy. I am doing this practice exclusively since then. Now coming to recognition of the system. My system is asymmetric technique. This technique has been certified by the ISO organization and they have provided me ISO 9001-2008 certification in the year 2008. Besides, our results have been verified at the RP Center of Ophthalmic Sciences, All India Institute of Medical Sciences in New Delhi, which is one of the largest center of eye care in the Southeast Asia. Also, our results have been verified from time to time by the media. They are coming, they are talking to the patient, and verifying the results, and they flash the stories so many times. Before proceeding further, just to create interest in this talk, I would like to submit a very interesting fact. There is one acupuncture point. It is termed as UB67, urinary bladder 67. It is situated at the angle of nail of little toe. 4,000 years old literature, Chinese invention, this is vision enhancing point. They are practicing for this also. Remember, just imagine 4,000 years old time when there was no metal, they were using stone needles. Now, it was being practiced. With the advent of technique, MRI and fMRI, recently it is seen that when this point is stimulated, there is always increased activity in the visual cortex of brain. It has been verified from so many places in the world. Now, why this hardware and software? You are stimulating point at the nail of little toe and you get enhancement in the visual activity here. Nature has provided us eyes in front of face, visual cortex behind, being controlled by little toe. And this is in very depth study. This is a depth understanding of Chinese system. And this verifies this fact that 4,000 years old, written in the Chinese literature, is mentioned and it is correct. Now, what this my mention indicates? It indicates that suppose there is some old saying, you don't just put it aside that it is a quackery. Or you can say only that today we don't have technique to verify the results, but tomorrow it may come the technique. That is the crux of this fact. At this juncture, I would like to tell a story of one patient, Ayush. He came to me last year. He is a teenager and he was suffering from macular degeneration. Before treatment, he was sitting here. I asked him what is able to see in this room. He was unable to see even this window. From this distance, unable to see this window, this scene, or anything on the table. He was given 3 hours continuous treatment after this. And just after treatment, from the same place, he was able to see window, he was able to see this frame, and after 3 sittings, he was read the lowest most line of the eye chart. After full course of 12 days, he has vision certified by the ophthalmologist. Aish was diagnosed heredomacular degeneration from the All India Institute of Medical Science, RP Center of Ophthalmic Sciences. He was diagnosed at the Gangaram Hospital also, and gifting him vision is a very pleasant experience. Since last 1 year, he is maintaining this vision. Moreover, results have been verified and certified in the OCT reports. We have both reports of OCT before treatment and after treatment. सामने नजर आ रहा है आपको?
खिड़की के बाहर
खिड़की के बाहर खिड़की नजर आ रही है ना? खिड़की नजर नहीं आ रही? विंडो नजर नहीं आ रही भाई? ये ग्लास विंडो है काफी बड़ी। ये आपके सामने जहाँ बैठे एग्जैक्ट सामने
सामने विंडो नजर आ रही है।
अच्छा,
हिंदी में लिखा है।
हिंदी में लिखा हुआ है। अच्छा, हिंदी आपने कैसे कही है? हिंदी कैसे कहा? ऊपर क्या वो खींच रखा है इसमें, कोई मात्रा खींच रखी ऊपर? हिंदी में अलग होती है लैंग्वेज, लाइन खींच देते हैं। चलो नहीं बता पा रहे हैं। आप अच्छी तरह देख लीजिए, फिर बाद में ये नहीं कहना मैंने अच्छी तरह देखा नहीं था। ठीक है ना?
करेंगे ना?
ठीक है, ओके। ये बताइए दिखने में नजर क्या आ रहा है? दीवार है और कुछ उससे पहले कुछ आपने कुछ और बोला है। खिड़की है। खिड़की नजर आ रही है?
हमारा ग्लास नजर
आ रहा है। कहाँ पर है? तो उससे पहले नजर नहीं आ रहा था आपको? हैं? अच्छा, कोई बात नहीं। खिड़की नजर आ रही है आपको? कैसा फ्रेम है? ठीक है, ठीक है।
एज ऑफ 70।
एज ऑफ
70।
अच्छा, ये श्योर आप पढ़ पा रहे हैं इसको सारा को?
पर हिलते हुआ दिख रहा है, पर सामने से ही दिख रहा है। CAT।
हाँ, अरे वेरी गुड, वेरी गुड। CAT। It means that definitely this system is helping patient, and patient has subjective improvement and also objective improvement also. I am showing you reports of OCT and certification of the ophthalmologist that patient has vision. Patient now walks independently on the roads and do all activities independently. This is not a small achievement for such a patient having life ahead in a teenage and having independence in the visual status. Definitely this is a remarkable achievement of this system, of this technique. Now coming to the technique of this system, it is termed as asymmetry technique. When patient contacts us first time, we ask him some questions about his visual status: near vision, far vision, color vision, night vision, glare in sunlight, and other questions. Suppose some patients suffer from the fogginess in vision, a feature of RP, develops after some time. So after receiving questions, we decide what investigations we require. Normally investigations required are a routine eye examination by the ophthalmologist, fundus photoplane for the normal patients, and angiography, fluorescent angiography for the diabetic patients. OCT If night vision is much affected, ERG also. These are the investigations for the modern medicine diagnosis. Besides, we have traditional diagnosis. Tongue diagnosis is very vital for such patients. It's just a visual of tongue reveals so many things. We have 200 pages book in Chinese literature about tongue diagnosis, and I will show you examples how tongue differ from patient to patient. Some have stomach deficiency, some have anxiety, some have spleen deficiency, some have yin deficiency. All these things can be revealed very simple and very vital diagnosis. Second is we ask certain questions and ascertain by this question tongue about the diagnosis, constitutional diagnosis of the patients. After that, when patient comes, we also examine his pulse, and pulse also reveals so many deep hidden facts about the disease. After assimilating both these diagnoses of modern medicine and traditional system, we plan the patient how to treat. Planning is very important. That is different for every patient. And now come to treatment part. Treatment part includes acupuncture, Chinese acupuncture, Suzhou acupuncture, and Ayurvedic acupuncture developed in India at the same time when Chinese were developing acupuncture, traditional acupuncture. Besides, on the base of this, we correct the constitution, and coming to regenerative technique. Regenerative technique, we have certain Ayurvedic herbs. We prepare fresh distillate of these herbs and pour these distillate at the certain acupuncture points, and it is shown, the results show that this works very well. After completion of treatment, it is usually 12 days for the patient. In most of the cases, we again examine him on the constitutional side and advise self-help. Self-help is very, very important. Around 40 minutes per day is required, and with this self-help, it includes our yogic knowledge of India, ancient India, massage on certain acupuncture points, dietary advice according to his constitution, patient constitution, and with this self-help, we are following the patients. Around 90% patients are stable over the years, and this is not a small achievement. Now, you must be thinking at this time how acupuncture works. What is acupuncture? There are so many theories to explain the acupuncture and acupuncture points. But I would like to give a very simple way to explain that in unison with the universal energies. There are 6 seasons on the earth. We start our year with the spring. After that, there is heat season, a low heat season. Spring is February and March. April, May are low heat seasons. After that, June and July, very, very hotness. After that, August, September, rainy season. October and November, it is fall, when leaves dry up and they fall. And then November and December and January, it is winter. That is complete. This is complete 1 year cycle. Now, have you thought earlier why these 6 seasons on the earth? This is very, very. Why these 6 seasons on the earth? This is well designed cycle by the nature, as oxygen is essential for life. atmosphere is essential for life, this change in atmosphere is also very vital to sustain the health of the creatures on the earth, including human being. Now, I would like to correlate with the seasons, with the disease cycle, with our own cycle of life. Now, coming to the spring season, life starts. The little baby as like buds, little buds, flowers came. So our childhood. Childhood doing very original thing. In childhood, we are doing very original activities, and people are attracted to us. Same flowers, they are very original. After that, we are in teenage. That is season of April and May, when there is low heat. After that, we are fully youth, that is June and July. After that, rainy season, when earth gains weight. We also get in 30-40s. After that, autumn season, fall, when we also have wrinkles, hair falls. This is in the fall season. After this oldness, after that is old age as cold season, and that is this complete cycle. Now, how to correlate with the disease cycle? Same pattern. Suppose you have acidity problem, feeling regurgitation, acidity, sore. In the spring season, they are coming sore fruits, and you are not treated well. Soon you feel burning in the stomach. That is heat season. You are not treated well, there is more heat, severe burning in the stomach. When you still not treated, you start vomiting. That is feeling heaviness. You start vomiting. That is rainy season. Is still not treated. You develop ulcer. That is dryness season. Still you not treated. Ulcer develops into cancer. That is old age. Same way, but this is not a theoretical explanation. There are vital acupuncture points, shoe points below elbow and below knee of all organs, and we have to calculate energy according to patient. Suppose I am treating dryness, ulcer in the stomach. To heal that, I need spring season energy. But how to give at that particular point that spring season energy or wind energy to counteract that dryness energy? It is the planning of treatment, it is the beauty of treatment. Nothing is coming from outside. Nothing is coming from outside. We are just transferring energy. If there is dryness somewhere, there must be more spring season energy somewhere else. So we have to counteract this dryness from which place, so healing occurs automatically. This is the beauty of this treatment. I told you this one simple explanation of acupuncture. There are so many principles in acupuncture. Have you ever thought? We have pairs of organs. Liver, gallbladder. Stomach, spleen. Kidney, unibladder. Brain, spinal cord. What is this uniqueness of this combination? This uniqueness in combination is, just think, one organ is solid, one is hollow. Stomach is hollow, spleen is solid. Liver is solid, gallbladder is hollow. Brain is solid, spinal cord is hollow. So this is not a simple design by the nature. It has very deep meaning, and I will not go in detail of yin and yang, from where this originated and how we transfer energy and how we diagnose this patient. But just for interest, I have given this fact, and I personally feel, and patient also feel, that all the positive aspects of all systems, whether acupuncture, whether Ayurveda, whether traditional system, whether modern medicine, they should be incorporated, best part should be incorporated for the healing of patients. This explanation was meant for that all our knowledge of medical sciences should be for the welfare of patient, for the healing of the disease. As I would again like to submit here, physics all over world is one, chemistry all over is world one, mathematics is one, but medical systems of treatment have been developed in every civilization independently. And this is the time, with the advancement of all techniques, we should assimilate all the knowledge. Now, next patient. Poonam, young lady, suffered from injury and retinal detachment in the year 1987. She was operated at the RP Center of Ophthalmic Sciences, and there was no vision after operation. She was sitting at home and going regular checkups at the AIMS when she was called, but there was no, for 4 years, there was no improvement. When she came to me in the year 2001, she had practically no vision. AIMS also, AIMS prescription we have, AIMS vision, I am showing you that. After 10 or 12 sittings, there was some improvement in her vision. And for 6 months treatment, continuously, she was treated 2 hours daily, exclusively she was treated. AIMS certified she has vision 3/60, and she was independent for her day-to-day activities, and she is maintaining this vision for so many years. At that time, I was slow in results. It took me 6 months to heal that lady. Now, with the experience, with the improvement of technique, and adding so many things, we have same results in 12 days. I treat one patient at a time, 3 hours daily, and patient usually responds very first sitting. He has been told that if you don't respond very first day, we will not continue the treatment. And we do a video recording before and after treatment. This is the improvement in results over the years. Anshuman, a software engineer, young person, he suffered right side optic nerve injury in the year 2004. He had no vision at that time. MRI scan shows injury to the right optic nerve. He came to me in the year 2007. He responded very well. On the very first sitting, he perceived improvement, subjective improvement. He was given 15 sittings, and then we go for the perimetry test that has been I am submitting, and it shows improvement. He was given more 15 sittings, and now he is 90% cured after 30 sittings, and he is maintaining this vision since 2007. I verified it just yesterday.
अंशुमान पाल एक ऐसे हैं शख्स हैं जिनकी दाईं आंख एक सड़क दुर्घटना में खराब हो चुकी थी। उन्हें साफ साफ दिखाई नहीं पड़ता था, लेकिन एक्यूपंक्चर से इलाज करवाने पर वो तकरीबन 90% ठीक हो चुके हैं।
मेरा रिस्पॉन्स है, पहला दिन में करीब 2 घंटे की सीटिंग हुई थी, उस दिन से ही मेरे को चेंज आया।
Sharif, a young patient from Egypt, came to me in the year 2009. He had very severe loss. We give one course of 12 days, and not much improvement. There was some improvement, but not much improvement. Next year he came again. I want to take one more course. He was again administered, after due investigation, he was again administered one more course. After that, he had some improvement, definitely more than that first sitting, I could say that is medium improvement. After that, he went to his country, and after 4 years, I even forget that patient. I received his mail that he is maintaining very good vision, he is 70% okay, and he has also sent his recent fundus photo. When I compare both the fundus photo, there is definite improvement. My next patient I am submitting is Kalpana. She is 60 years old. She came from Pune 2 years back. After first sitting, when she came in this room from inside, she was sitting here and is seeing this. She then told me, in the morning there was no window. There was no scenery. I told her that it has been created now. In the light mood, I told her. So that is the effectiveness of the system. I am putting a video on experience. ये अच्छा इम्प्रूवमेंट है, ऐसी बात नहीं है. आपको पत्ते नहीं दिख रहे थे, पत्ते आउटलाइन नहीं दिख रही थी, ब्रांचेस नहीं दिख रही थी.
ब्रांचेस दिख रहे थे.
तो फिर आप इसको आप फोड़ा क्यों कहते हैं?
और यहाँ कुछ पहले कुछ था या नहीं था?
था, सुबह भी था. आपको दिखा नहीं था?
नहीं.
अब दिख रहा है?
हाँ. कुछ डिजाइन था.
डिजाइन
है.
हाँ, अभी बनवाया है. आप सो रही थी तो उधर वो मिस्त्री बना रहे थे.
नहीं, सुबह को क्यों नहीं दिख रहा था? शायद ब्राइटनेस है इसके लिए.
सुबह था नहीं. हाँ, ब्राइटनेस थी सुबह, लेकिन ऐसी ब्राइटनेस भी नहीं थी.
ऐसी धूप आती नहीं ज्यादा.
हाँ, ठीक है ना.
अभी एकदम
क्लैरिटी आ गई. Thank you very much for inviting me.
Yes.
Though I am unable to come due to clashing of dates, there is a very big festival as US Christmas. We have Deepavali in this time, so unable to come. But definitely, I am feeling very honored, very humble for this invitation. I am sending this video, and I feel this will give a message to the medical community. It is very committed treatment. We do only one patient in time, and feel and hope many more patients will be able to see this mesmerizing world. Thank you very much again.